57% of the calories that the average American is eating are from ultra-processed foods. Hippocrates said it thousands of years before I did. All disease begins in the gut, and so that's where we have to look for solutions.
Hello, I'm Dr. William Morgan, president of Parker University, and we have a very special guest today, Dr. Robynne Chutkan. Dr. Chutkan, thank you for joining us.
Thank you so much for having me. It's always a pleasure coming to Parker.
Can you tell us a little bit about your background?
I'm a gastroenterologist, conventionally trained. I've done probably about 16,000 colonoscopies. But in the last decade, I've taken a little detour. So my interest right now is much more on the foundations of gut health, on how to create a healthy microbiome, on how to use nutrition to enhance gut health. And in fact, I spend a lot of my time now, instead of doing colonoscopies, helping people get off medications, helping people learn how to have a healthier gut. So it's a little more of an integrative approach than my first 20 years or so in practice.
But all that accumulated into the knowledge you had today and to see what the problem was. You also speak a lot about the gut biome and the brain connection and about dementia, Parkinson's, some of these diseases that have been attributed to aging that actually may be attributed to more to gut health.
You're absolutely right. I think when it comes to some of these neurodegenerative disorders like Alzheimer's, Parkinson's, MS, even ME, CFS, long COVID, autism spectrum disorders, we've been looking in the wrong place. And certainly these are diseases that affect the brain profoundly. But it turns out there's really compelling evidence that a lot of them begin in the gut. If you look at the gut first theory that's now being popularized for Parkinson's disease, Dr. Parkinson 200 years ago described Parkinson's disease, what he called shaking palsy. And he even noticed there was a strong correlation between constipation and gut issues back in 1817. And fast forward now, we have some incredible research in the last decade showing that these abnormal proteins develop first in nerve cells in the gut and then in the brain. So hence this idea of a gut first hypothesis for diseases like Parkinson's and Alzheimer's in some people.
So for maintaining cognitive function as we age, to get that, the desire that we have is to expand the health span, to lengthen that, to make it closer to the lifespan of a human. How can we expand the health span of the brain to prevent Alzheimer's and dementia?
Well, Dr. Morgan, Hippocrates said it thousands of years before I did. All disease begins in the gut. And so that's where we have to look for solutions. So we can't separate these two organs. We have to recognize a bidirectional communication, the reliance on one for the other. So we know that the brain, for example, controls motility of the gut, secretion of digestive enzymes, absorption of nutrients. We know that the gut affects production of neurotransmitters, mood disorders, cognition. And so we really have to look to the gut, I think, for some of these solutions. And of course, starting with foundational things like what are people eating? We know that the key to a healthy microbiome is eating a lot of plant fiber. The plant fiber is metabolized by bacteria to create short-chain fatty acids, arguably one of the most important post-bacterial metabolites, not just important for gut health, but important for immune function and important for brain health. We have to think about sleep hygiene, affects the gut, affects the brain. We have to think about exercise, and we have to be more judicious in our use of medications. We know that medications like antibiotics, medications like acid blockers are profoundly interrupting the gut microbiome, the pH, the integrity of the intestinal lining, nonsteroidal anti-inflammatory drugs. All of these pharmaceutical interventions that are very effective at treating whatever it is they're treating, but are also having a disruptive effect on the gut. And that disruption can trickle up, if you will, to affect our brain. So when we think about brain health, first of all, we need to not think about it in a vacuum. We need to think about it in association with what's going on in our gut. We need to be more judicious with the medications. We need to eat more plant fiber. And we need to take care of our gut in general so that we can have a healthy
So
brain.
someone who's entering a phase of life where maybe they're in their 60s and they want to have two more decades of good productive health and mental acuity, what pragmatic advice would you give that person?
Well, I don't think you have to necessarily become a vegan, but we all need to eat more plants. We know from the American Gut Project data about 5 years ago that the single most important predictor of a healthy microbiome is the number of different plant foods people are eating, with 30 or more different plants being the magic number. So you can still absolutely have your porterhouse or whatever it is that you're having in the animal protein realm, but we really need to ramp up our ingestion of fruits, vegetables, beans, nuts, seeds, herbs, spices. All of these things are incredibly important. All the polyphenols and the phytochemicals in these plant substances, very important for gut health and for brain health. So that's a very important consideration.
So longevity, if we look historically, has changed dramatically. 10,000 years ago, if you could live to 29 years old, you could leave your genes behind and reproduce before you die, and maybe die from probably infectious disease or not enough nutrients because of famines. Once we've broken through hygiene and having antibiotics, it grows longer. And then you hit a next barrier, cardiovascular disease or the other diseases. As we break that barrier, it gets into dementia. Every time we unfold these barriers to longevity, we push it to the next level. And then right now it is dementia, but how can we, move the needle so that we've eliminated these other barriers? Because that's the next barrier. What do we find after we eliminate dementia? What's the next disease that starts manifesting itself broadly?
Well, to pause for a moment on dementia, because I think it's a really important one when we consider the gut. Most people, when they consider dementia, they're not considering the gut at all. They see this as something that's completely dissociated. And the reason it's so important to address this now is because an amount of ultra-processed foods that we are eating in the American diet has just passed 50%. 57% of the calories that the average American is eating are from ultra-processed foods. And the association between ultra-processed foods and not just morbidity in terms of cardiovascular disease or metabolic disease or mortality in terms of death, but in terms of dementia are striking. So we know that not only is it that we need to eat more fruits and vegetables, beans and greens, but we need to stop eating this tremendous amount of ultra-processed foods, because not only is it making us sick and it's killing us, but it's also making us demented.
So you introduced a term, and at first I thought you said rewire, but you used the term rewild. Can you expound upon that?
Rewilding is a term I've borrowed from this sort of ecological world, and it refers to restoring a habitat to its more natural and balanced environment. And what we're seeing, if we look out at the world, at overfishing and deforestation and climate change and everything that's happening, we see similar things happening in the human gut. So if we consider the human microbiome, we know that we only have about 2/3 of the species that our brothers and sisters in the Amazon or the Hadza tribe in Tanzania, hunter-gatherers, have. And actually their microbiomes are at risk now too because of industrialization encroaching on their natural habitat. So we are missing a tremendous number of microbes, and we're missing diversity of species, which is probably the most fundamentally important aspect of microbial health, is species diversity. So when I talk about rewilding, in order to have a diverse microbiome, you need to have a diverse diet. And that's why the diversity of plant foods is so important. That's why the exposure to nature and to soil microbes is so important.
I practiced in Western Africa for a period of time, and actually in Asia, and where there was virtually, like as you were talking in your talk, very much similar to our ancestors, maybe like people were living 10,000 years ago, very aboriginal. They certainly have a diversity of bacteria and parasites, but they didn't experience long life. Very few people lived it into their 60s, and infectious disease took them. And they had great diversity, and they had some of the parasites that you'd have said would be beneficial, that we've adapted to that would actually help suppress some of our autoimmune diseases. How would you rectify that, or where's the sweet spot?
You've hit on such an important point, which is this distinction between communicable diseases and non-communicable diseases. And until a few years ago, the majority of people in the world were dying from communicable diseases, from cholera and tuberculosis and other things that, as you said, people living in sub-Saharan Africa with a very healthy microbiome, but dying from cholera or from malnutrition because of lack of access to food. But now we're seeing the pendulum swing the other way. And so we are now at a point in history where more people are dying from non-communicable diseases, like metabolic disorders like obesity and diabetes and all the hundreds of autoimmune diseases that we're seeing. And so the sweet spot is, how can we rewild ourselves enough without going all the way back to the cave, but try and create and maintain a healthy microbiome through the things we've talked about: judicious use of medication, a healthy diet, etc., not being too clean all the time, but also take advantage of these incredible tools in our toolbox, like antibiotics that have saved millions of lives over the years and are arguably the most important discovery in modern medicine. Could have saved millions more during the Great Plague when so many people perished. So we definitely don't want to abandon modern medicine. We want to take advantage of antibiotics and vaccines and all the other different medications that help to prevent these communicable diseases that are still killing millions of people every year. But we have to balance it, and I think we have to apply these remedies and these cures in a more judicious fashion, and we have to pay attention to these foundations of health that really don't change throughout the ages.
And we talked a lot about dementia and Parkinsonism, but there's 3 other conditions that claim the lives of a lot of people. Of course, cancer, heart disease, and diabetes. What you're proposing, how does it affect those diseases?
The 3 diseases you've mentioned, cancer, heart disease, and diabetes, are all linked to dysbiosis, to a disrupted gut microbiome. Now, it's not a straight line, and it's not the only thing, but if you think about the factors that cause most cardiovascular disease, which are external factors like smoking and diet is a huge one, the same dietary factors that cause people to develop cardiovascular disease, namely too much animal protein and fat, not enough plant fiber, also disrupt the gut microbiome. And we know through some of the studies on TMAO and others that there's a really strong correlation between what's going on in the gut microbiome and what's going on in our coronary artery diseases. Diabetes also, something that is increasingly a problem, not just in the more developed world, but in less developing countries also. And we also see profound changes in the gut microbiome. Now, for some of these changes, it's hard to know what's cause and what's effect, because illness itself can cause changes in the microbiome. If you look at something like COVID, a viral illness, we know that people with a messed up microbiome, if you will, people with dysbiosis, have a much worse outcome from COVID. But we also know that the binding of SARS-CoV-2 to the receptors induces dysbiosis in the gut. So it's complicated for some of these conditions to know, is it the disruption in the microbiome that's causing the disease, or is the disease in some way causing the disturbances in the microbiome? But we do know that, again, these foundational pillars of health, of diet and exercise and sleep and stress reduction, etc., are, whether it is cause or effect, are helpful, the primary prevention. And so I think the trick is that we want to hold on to all these incredible medical innovations while also paying attention to the foundational pillars of primary prevention.
Well, there's a nuance in their use. Enough, but not too much. Not overuse.
Yes.
And use it, but then after you've had an antibiotic, how do you overcome that? And you talked about fermented foods. So there are some studies that show, like eating pickles, is related to higher stomach cancer.
Yes.
So fermented foods have a positive effect, but they also, like in Japan, where they eat lots of fermented foods, they have a higher rate of stomach cancer. What have we found about that?
Yeah, some of those nutritional studies in countries where they eat higher rates of fermented foods, like parts of Asia, have extraordinarily high rates of stomach cancer and esophageal cancer. But a lot of that is they're also eating lots of smoked foods also. And the burning of the food creates carcinogens. It's a little bit hard to sort out some of that data. I dare say it's probably more the smoked meats than it is the pickles. But, there are also different genetic variations that will cause people to develop disease in the setting of different factors. So, for example, if you look at something like Helicobacter pylori, H. pylori is a benign organism for most people, but in other populations, it's strongly linked with stomach cancer. So it does depend on what the background noise is. Some of the epidemiological data on H. pylori suggests that in populations in South America who are unexposed to it, when Europeans came over hundreds of years ago and introduced it it created more virulence and was more strongly linked to stomach cancer in those populations. Other epidemiologists have suggested that H. pylori is actually a necessary and critical part of our gastric flora, and that eradicating it with multiple rounds of antibiotics is a really bad idea. So I think, as you said, the answer, if you will, is nuanced for some of these conditions, and sometimes what works in one population may be problematic in another.
We were having a discussion earlier about Scotch, which actually has grains in it. Does that count as one of the 30
Plants?
plants?
No. I think it came from a factory before it came to you. But I've never had somebody ask if they get credit for Scotch. So this is what I'm going to do. Rob Knight, who runs the American Gut Project, he's an Irishman. I think I should go straight to the source.
Oh, yeah. If he's Irish, we know that he's going after Jameson. The other thing for the pickles is like you said, for factories, there's pickles, there's pickled food, and then there's processed pickles.
Yes.
With nitrates.
With nitrates and a lot of salt also. So the processed pickles essentially can, depending on, what brand, can qualify as an ultra-processed food according to the NOVA classification versus a sauerkraut that you're making at home.
I had COVID about a month ago. Bad. Conjunctivitis, urethritis, gastric,
oh my goodness,
upper respiratory, brain fog.
Your first time with it?
And I've had 3 shots too. And I had a urinary tract infection with took antibiotics for a pretty good dose of antibiotics. And the day I tested negative, finally, after all of this, extreme anxiety. And like I said, I'm a diver. I've swam with big sharks in caves. I don't get anxious.
Navy. I know who you are.
I don't get anxious
Type.
Anxiety to the point of being life-threatening.
Well documented for how some of these viral illnesses can affect our brain. I mean, think about it, and not to raise the alarm, but MS, multiple sclerosis, strongly linked to Epstein-Barr virus.
Oh, yeah.
And look at the effects of something like MS on the brain. Fortunately, what we're seeing with post-COVID is that we're tending to not see those very dramatic, chronic neurological changes. Certainly people have symptoms, they have brain fog being one of the main ones. And the brain fog from long COVID and post-virally is very real. And it's interesting, people are so skeptical about long COVID. And I say to people, AIDS is a post-viral syndrome. AIDS is chronic HIV. That's the ultimate sort of long HIV. When somebody is infected with HIV virus and then goes on to develop autoimmune deficiency syndrome, that's a chronic post-viral condition. Hepatitis.
The virus has been cured, but your body's reaction to it lingers.
Exactly. Even when you see viral load being low, you're not acutely infected with HIV anymore, but it continues to wreak havoc in the body. If you think about cirrhosis, liver damage, that continues on for long after you've been infected with hepatitis B or C. So we have a lot of precedent. If we think about something like mono from Epstein-Barr virus, we know that kids get infected, they get acutely ill, and then 10 years later, you can have a recurrence of mono. Shingles after varicella. Had chickenpox as a kid, 50 years later, you have shingles. So we know that viruses can be dormant in the body, and they can reactivate, and they often reactivate in times of stress. And the symptoms that you describe post-COVID of severe anxiety, I had a friend of a friend in the sort of peak of the pandemic who had left New York and was living in Miami, got COVID, was down there by himself, and I was sort of providing some support by phone. He developed incredible anxiety. At one point, I had to call the hotel where he was staying and have the manager go check on him. And I didn't know him well. And I kept saying to his friends, is he normally like this? And they said, no, he's the calmest person. He developed full-on panic attacks from the virus as a result of the virus. I'm happy to say back to normal.
How long did that
Back to normal. That went on for, the time I was dealing with him acutely was a few weeks. And then I've spoken to him since, and I think it went on for the order of a month or two. And I think early on in the pandemic, it was challenging to tell because it's like, okay, the world is ending, right?
Yeah, yeah.
I mean, things were so disrupted.
You didn't know if it was psychosocial or if it was actually the virus.
But now we know because, we're in a very different situation now. And people are reporting these very real and acute symptoms. And as I discussed during my talk, we can induce changes like this in mice and in humans with giving them inoculums of different bacteria.
When you talked about the mice having nearly sterile gut biome,
yes.
and having anxiety, so I just finished with it. I've tested for
The antibiotics.
I had a urinary tract infection as well. So they gave that along with it. Was it the antibiotics? Was it the virus?
I wonder if it's a combination. What we do know about that is that if we look at rotavirus, which is a virus that causes a diarrheal illness in children, and in most children it's relatively benign, but kills about 400,000 children every year. Children who have a course of antibiotics before they get infected, right before they get infected with the rotavirus, do far worse outcomes. And I found that out in researching this last book, The Antiviral Gut. I came across a bunch of studies, but I experienced it as a mother when my daughter was 3 years old and got rotavirus, misdiagnosed at the urgent care as an ear infection. She was vomiting and quite sick, and they took a look in her ear and said, oh yeah, she got an ear infection, which she didn't. Gave her a course of antibiotics. She ended up hospitalized for that rotavirus infection with kidneys failing and liver failing.
Good heavens.
My husband had just gone on a plane to Guam for work. He had just flown 24 hours and arrived in Guam. And I called him and I said, you got to come back. Sydney's in the hospital. She's really sick.
Oh.
And he turned around and came back. But at the time, I made no association between her antibiotic course that she'd been given and the rotavirus being so severe right on the heels of that. And when I read this study last year, I couldn't believe it. I said, this makes perfect sense.
Put together.
Yeah.
Well, thank you for joining us today.
You're so
It's been a
welcome.
pleasure. You've been listening to Dr. Robynne Chutkan, and this is Parker University.